My name is Dr. Shabeeha Rana. I'm consultant hematologist and director of cancer services at King's College Hospital, London, in Dubai. Today I'm going to talk about an important therapeutic procedure or a process which actually removes some components out of the blood via a machine. This procedure is called apheresis. It is a process which eliminates the unnecessary blood components or elements out of the body via a machine, which expedites the process and the time for the process that can be done manually over 12 hours. But with this machine, it can reduce it to probably 2.5 to 3 hours in some procedures, and in some a maximum of 6 hours. This is the latest advanced machine which actually can remove plasma in some procedures and some conditions where plasma exchange is recommended by our neurology colleagues, nephrology colleagues, or sometimes even by the ICU physicians. In hematology oncology, we use this machine for many reasons. We use it for red cell exchange. Red cell exchange is a process which is used in patients with sickle cell anemia, when these cells actually cause sickling of the red cells for many reasons. When they become crescent-shaped and cause problems in blood circulation, patients can have problems with severe pain, renal failure, abdominal pain, bone pain, sometimes to the extent of developing chest syndrome, which is tightening of the chest and breathing problems. It can even lead up to stroke. Patients who present with any of these problematic conditions with sickle cell anemia, causing either chest syndrome or some other complications, may require treatment with red cell exchange. Red cell exchange is a process which is primarily done by this particular machine called Optia Spectra, which removes the unnecessary or the damaged red cells from the circulation and replace it with clean blood, which is given parallel. The machine is clever enough to eliminate only the damaged cells. It returns the rest of the volume back to the patient. Sometimes we do see problems and side effects while being on the machine, having some tingling and numbness around the mouth, which is mainly a side effect because of the drop in calcium levels. This is easily taken care of by giving a parallel infusion of calcium. The second indication that we use this machine for is called plasma exchange. Plasma exchange is recommended for multiple neurological, rheumatological, hematological, or sometimes in obstetric conditions as well. This condition takes care and eliminates the unnecessary or wrong plasma, to say, out of the body, which is full of these unwanted antibodies, causing problems and conditions like Myasthenia gravis, thrombotic thrombocytopenia purpura, or other reasons. The Optia Spectra machine is programmed to eliminate the unnecessary or unwanted antibodies by removing the plasma into the machine and replace it with clean plasma. It is a process where it only saves out the abnormal plasma contained with these abnormal antibodies, and the rest of the blood components are delivered back to the patient. The machine that performs these procedures, including red cell exchange or plasma exchange, is very efficient. A manual red cell exchange, for example, can take up to 12 hours. The same procedure performed by the machine can take up to 2 hours to maximum 3 hours. Similar to plasma exchange, which can perform numerous hours in the ICU or other outpatient settings, or patients have to be admitted for this particular procedure, can be done in a very quick and very efficient outpatient manner. This efficiency improves patients' stay during the hospital, giving a very short hospital admission time, but also improves the efficiency of the nursing care as well. One of the main uses of Optia Spectra machine is to actually remove the stem cells for the purpose of autologous or allogenic bone marrow transplantation. Bone marrow transplantation is not a surgery. It is removal of the stem cells from either the patient to be given back to the patient in the form of autologous stem cell transplant, or collection of stem cells from a donor, which is collected via the peripheral blood cells and given to the patient. These stem cells are collected by the same machine called Optia Spectra. The principle applied here is also similar. It is a sieving process which eliminates the stem cells and returns the other normal components back to the patient. The procedure is very well tolerated. The time duration for the procedure can range from 4 to 6 hours and sometimes up to 8 hours, depending on the efficiency and how the patient is tolerating it. Generally, it is considered safe, and sometimes we do see side effects, particularly tingling or numbness around the mouth or in the hand, mainly because of low calcium levels. This is easily taken care of by giving a parallel calcium infusion. Here at King's College Hospital, London, Dubai, we are the first DHA-approved facility to offer this program to patients who require this procedure. As I mentioned earlier, this procedure is required by our physician colleagues, including neurology department, nephrology, ICU, and of course, hematology oncology.